Welcome back. In this video, we review the surgical management of an acute unstable PIP joint dislocation of fifth finger. Following a successful close reduction, notice how the joint opens up significantly on stress testing, confirming a complete tear of collateral ligament. We begin by administering a digital ring block at the base of finger for regional anesthesia. Once the finger is fully anesthetized, we proceed directly to the approach. A medial mid-axial incision is made, centering precisely over PIP joint, allowing direct access to damaged structures. This approach will keep distal artery and nerve polar to the incision. A careful blunt dissection is performed through the soft cutaneous tissue to reach the capsule. Here we isolate torn collateral ligament. It is an acute mid-substance tear, and because the tissue quality is good, a primary repair is highly viable. We use a 4-0 Prolene suture in interrupted fashion to approximate the proximal and distal end of the torn collateral ligament, restoring the continuity of the ligament. And be careful not to over-tighten the ligament. With the repair complete, we repeat the stress test. The joint now demonstrates excellent stability with minimal to no residual opening. To protect our primary repair during the initial soft tissue healing phase, we choose to temporarily immobilize the joint internally. A 1.5 mm KOR is passed obliquely from the ulnar border of the proximal phalanx, crossing the PIP joint into the middle phalanx. And this KOR immobilizes the joint. With the joint securely held by transarticular KOR, the skin is closed in a simple interrupted fashion. Finally, a sterile dressing is applied and the hand is immobilized in an ulnar gutter slab. If you found this quick surgical demonstration helpful, please give us a like, leave your comment, and subscribe the channel for more orthopedics content. Thank you for watching.